Mrs. Smith. Thanks for coming to the clinic today, and I'm sorry about your discomfort due to UTI, but no worries. We will prescribe you some antibiotics, which will be effective for your urinary tract infection, and you will feel better very soon after you take all the antibiotics. The antibiotic that I'm prescribing you today is Bactrim DS, which is effective against UTI, and you'll be taking this antibiotic 2 times a day for 14 days. And it's very important that you must finish this antibiotic and not to leave it halfway in between. And if you feel any reactions or any discomfort, you call the office right away so we can address the discomfort or any adverse reactions. So I can tell you something about this antibiotic, which can help you understand the medication you're taking, hopefully. And there's some aspects to this antibiotic, and first is called pharmacodynamics, which is the effect of and reaction of the drug and within the body. So Bactrim DS is a combination of 2 antibiotics, which makes it very effective and strong against infection, and they work together to kill the bacteria by stopping bacterial enzymes over the course of antibiotics, which is why it is important that the antibiotics should not be stopped halfway through. And then the other aspect of this antibiotic is pharmacokinetics, which is the process by which the drug is absorbed, is distributed, and metabolized and eliminated in the body. So Bactrim DS is absorbed well by taking it by mouth, and it reaches the system widely, and it can be taken with or without the food. If you feel discomfort taking the antibiotic without food, then you can take it with food, so avoid any stomach discomfort. Like I said, this antibiotic is widely distributed in the body, and it reaches your blood and urine and cerebrospinal fluid, which is all these fluids in the body that can this medication can be more effective against fighting the bacteria. This medication's half-life, and half-life is the amount of time that it takes for this drug, that half-time is the amount of time it takes for this medication to be reach 50% in the body. So that's why it is prescribed 2 times a day, and it's important to follow the instruction to take it 2 times a day, and not to forget that. And if you forget the dose, you should take it as soon as you remember, which is okay. And then also this medication is Bactrim DS, your antibiotic, is excreted or leaves your body through the urine, and that is why it is very effective against UTI, so that's good to know. And then some of the potential adverse reactions that this antibiotic may cause are and if any adverse reactions occur, like I said, feel free to please call the office right away and not to stop the medication by yourself. Some of the adverse reactions are nausea, vomiting, rash, diarrhea, lethargy, feeling tired, photosensitivity, which is being sensitive in the sun, and hypoglycemia, which is lower blood sugar. So it's important to keep an eye on these adverse reactions. And then some of the considerations for pediatrics and elderly, like children and older population, is pediatric population. And pediatric population, Bactrim DS is very safe, but in pediatrics age 2 months and above. Since this antibiotic is a combination of 2 medications, antibiotic, which makes it very potent. So it is not recommended for patients lower than, or pediatric patients lower than 2 months. And also in elderly, we use it cautiously with elderly that have renal impairment, or because this medication excreted through the urine. So it's very important to make sure that patient's urinary function is not impaired, and keep an eye on the renal function. Okay, Mrs. Smith, if you have any other questions, feel free to call the office, and I hope you feel better soon, and take care. Bye.